Let me remind you that the gold standard for allergy treatment is, first and foremost, the removal of the causative allergen. For example, cats, dogs, or birds, if the patient is allergic to a household pet. Second, if we are unable to remove the allergen from the patient's environment, then we need to relieve acute symptoms using anti-allergic medications. According to ARIA, which is an international agreement on the treatment of allergic rhinitis, please note that nasal medications are used. These include topical glucocorticosteroids, topical antihistamines, topical chromons, and systemic medications. Antihistamines and leukotriene inhibitors are the first-line treatments, and in severe cases, hormonal medications are used. So in this regard, allergic rhinitis is classified into 3 degrees of severity. Mild cases, which almost never reach the doctor, are treated independently. Moderate and severe forms of allergic rhinitis differ from mild cases only in that the patient's general condition is affected and therefore they cannot avoid seeking treatment. And that's why, as usual, they will first go to the pharmacy. This will only help him temporarily, only then will he go to the doctor. That's how it is. And in this case, we will use this range of locally acting and systemic medications. Among systemic medications, antihistamines are the main ones. So the international ARIA guidelines provide us with information. It is necessary to use non-sedating second and third generation antihistamines. These are the drugs desloratadine, fexofenadine, and levocetirizine. Next, among nasal glucocorticosteroids, we use only the selective ones, Nasonex, Avamis, Flix, and Pharenex. If there is accompanying allergic conjunctivitis, we use Maxidex, Chromogexal, Chromosandes, Chrometal, Chromopharm, and so on. If our patient has a tendency towards severe systemic allergic reactions, for example, angioedema, urticaria, a history of anaphylactic shock or severe asthma attacks requiring hospitalization in the intensive care unit, then they must always carry in their first aid kit 2 ampoules, dexamethasone or any other injectable glucocorticosteroid, and suprastin or any other antihistamine, along with a syringe. If they have experienced episodes of shortness of breath, then it is essential to have a pocket inhaler, such as the most common ones, Beradual, salbutamol, or Ventolin. It is also very important for the patient to establish the right lifestyle regimen. For example, if the patient is allergic to plants that bloom in May, June, August, or September, then their time spent outdoors should be limited. Walks are recommended in the morning during the first half of the day. Ventilating the room is recommended in the evening. At the same time, it is advised to cover the windows with gauze and to periodically moisten the gauze before airing out the room. Daily wet cleaning of the premises is recommended, preferably twice a day. If a person goes outside, it is advisable to cover all areas of the body during the walk, that is, to wear closed clothing and put on glasses in order to reduce the exposure of allergens to the body. When you come home, take off your clothes, wash them, take a shower, and these measures help to reduce allergy symptoms. Next, if the allergy is to household dust or dust mites, then in this case, wet cleaning of the premises 2 to 3 times a day becomes the top priority, as well as the mandatory use of a vacuum cleaner with a water filter and, above all, frequent ventilation of the rooms. If you are allergic to feather pillow mites or feather pillows, it is recommended to completely remove wool blankets and feather pillows. Remember that down is also found in down jackets and coats. Patients very often forget about this. Again, all these measures should only be taken after allergy testing so as not to perform unnecessary and uncomfortable actions. And lastly, there is one more thing I would like to tell you. Socrates once wisely said, "Before you begin to treat your patient, First ask him if he is truly ready and willing to get rid of all the causes of his illness. If he is indeed ready, then you will have a 100% positive result, without any doubt.